Hi, my name's Leif, and today I thought I'd talk a little bit about some injury management I did to myself for a bit of a knock to the ankle. Fortunately it was just an impact injury where I sort of fell backwards from a handstand and hit a bit of a pole, so there was no twisting or dynamic sort of type effect in the injury. But it still hurt a bit, so I thought I'd go through a treatment I did to help relieve the pain.
Yep.
Okay, so here's my little foot, and I cracked it right on here, so this is where I took some impact, and it hurt quite a bit. Not too much swelling. I could walk afterwards, but it definitely was sore. And so with the lateral malleolus being affected, there were some tender points around bladder 60, so I suppose you could feel some problem through there, and also on the gallbladder channel running down the front, so somewhere in the middle. So to help with lymphatics and moving any fluid, I wanted to use spleen 9 and spleen 7. So I've just used a marker pen just to indicate a bit better where spleen 9 is and spleen 7. So spleen 7 is leaky valley, which sort of translates to any kind of fluid problems, as well as spleen 9 has a good effect on moving fluid, being the spleen and earth's transportation and transformation function. I also wanted to use spleen 5 being a special point at the ankle. It was also a bit tender, so this is usually a good indication to use a point. I also wanted to use kidney 7 being the special point for bones, also good for any problem dealing with bones or bone trauma. Okay, so I also wanted to use some points above and below on the channels of the affected area. So I want to use gallbladder 41 as well as gallbladder 39. Actually both quite active, seem to be good points. I also want to use bladder 60 and 59. I also wanted to include gallbladder 34 and stomach 36. These guys have a good effect on any sort of ankle problems down here, and especially at the front of the malleolus. So I like to include those. Okay, so now we'll just do the needling on the medial side. Excellent. So just to enhance the performance, I'm just going to run a bit of electric between spleen 9 and spleen 6. Okay, so then we continue the needling here on the front side. So So I got gallbladder 39 and gallbladder 41. Bladder 60. And then gallbladder 34. I found if you tweak these points a bit, you can get a sensation that does run down to the affected area around the malleolus. Stomach 36. Oh yeah. So that's getting a good twitch. I'm feeling it locally here as well as down the ankle. Okay, so I'm just going to attach some wires for the electric. So I also run a small microcurrent between these 2 points. And spleen 7 being the stronger of the two, I'm using the black lead on that point because that's where I want the focus of the effect to go. So this is the TENS unit. TENS stands for transcutaneous electrical neuromuscular stimulation. Quite a big mouthful, but essentially it means you're sending a current between the two clips that you put on, so you've got a positive and negative end. So look, we're just gently going to turn up a little bit of juice. And on the other side. And on this side, I just want to run a little bit of electricity through bladder 60 and bladder 59. Just to help shift things along, get some of those enkephalins going, keep blood circulation, stop sort of any stiffness from setting in too deeply. I also found it helpful to apply gentle massage and frictions running up and down, just on the fibula bone, just on the tibialis anterior and just a little bit behind. I didn't go too close to the affected area. Obviously, if there is localized inflammation, it needs to settle and clear a bit, but yeah, just working the surrounding tissue gently, just finding any of those slightly sore spots and you know, giving them a gentle rub helps get things along the way. So to help support this treatment, I decided to use one of Tung's or Master Tung's acupuncture points on the thumb, one of the fifth woohoo, just located there. In combination with PC7 or pericardium 7, just treating the opposite side of the body. So I banged my right side, so this is my left hand. So here you can see I can use shorter needles, as you know, there's a lot less flesh there, and it's quite sensitive, so you don't need to go too deep and heavy. So, and that's for the opposite side, so this is the left hand. So I did this treatment on the following day and the day after that, and it definitely helped get mobility back. I was able to walk up and down stairs without doing a step at a time within 36 to 48 hours, and now going on maybe 4 days, it's
a bit sort of sore and itchy sort of feeling, but I can still do everything that I need to. Hope you've enjoyed the video. Thank you.